Hello, my dear friends. This is Dr. Charles from PHI Preventive Health Institute, where we share practical lessons drawn from real cases we see every day. Behind every symptom is a real story, and today's topic, joint pain from crystal formation, is inspired by a case we recently encountered, more common than many realize. That's why we approach it from four angles: what the doctor evaluates, what the nurse observes, what the pharmacist safeguards, and how the dietitian supports recovery. This is the dietitian's perspective. There is a pattern we often see with this kind of joint pain. It starts quietly. Pay attention to the early signs. A stiff finger in the morning, a swollen toe after a heavy meal, a knee that just doesn't feel right. It's easy to dismiss. Maybe it's fatigue, maybe I slept on it badly, but then it returns, more painful, more swollen, harder to ignore. And over time, it begins to affect how you walk, move, and function. At that point, it is no longer random, it is a pattern. From a nutrition standpoint, this is not just about the joint. It is about balance inside the body: calcium, magnesium, uric acid, hydration, all interacting. When this system is stable, joints remain quiet. When it is not, crystals can begin to form. Now look at daily habits: high salt intake, sugary drinks, processed foods, frequent fried meals, low water intake. Individually, they seem small, but together, they shift the system. They increase inflammation, they reduce kidney efficiency, they disturb mineral balance, and over time, they create the right environment for crystals to build up in joints. Hydration is central. Proper water intake is vital for your health. When you don't drink enough water, substances like uric acid and calcium salts become more concentrated. And when concentration rises, crystals form more easily. So it is not just what you eat, it is also what you are not drinking. Then comes magnesium, often overlooked. Magnesium helps regulate how calcium behaves in the body. When levels are low, calcium can deposit in places it shouldn't, including joints. So the goal is not to avoid calcium, it is to keep the system balanced. Now step into support. Focus on leafy vegetables, contumaya, aleppo, cabbage, fruits, banana, pawpaw, oranges, watermelon, whole grains, millet, oats, brown rice, magnesium-rich foods, beans, groundnuts, seeds, and most importantly, regular water intake, because these help improve hydration, support kidney function, balance minerals, reduce inflammation. Now reduce what worsens the system: sugary drinks, excess salt, highly processed foods, frequent fried meals, alcohol, because they quietly push the system in the wrong direction. Then bring in consistency. Small changes lead to big results. Drink water regularly, not just when you feel thirsty. Keep your body moving. Even simple walking helps joint circulation. Now step back. The kidneys filter. The blood carries minerals. The joints reveal imbalance. Everything is connected. Everything is connected. So when you adjust your diet, you are not just managing pain. You are restoring balance, protecting your joints, and reducing the risk of future flare-ups. Final point: not all joint pain is just aging or strain. When it keeps returning, especially with swelling, it is often a metabolic signal, and relief is not the same as control. So do not ignore the pattern. When to act: if you notice recurrent joint swelling, pain after certain meals, dehydration, or a history of high uric acid, do not ignore it. Early dietary changes combined with proper medical care can significantly reduce flare-ups. Speak to your healthcare provider for proper assessment or call/WhatsApp +233 208 7203 47. And remember to explore the other three perspectives because each one completes the picture.